Hey everyone, it's Dr. Anna Cabeca. I am here with you with two of my amazing esteemed colleagues, Dr. Angeli Akey and Dr. Kathleen O'Neil-Smith. Dr. Akey is trained at Yale University. She's in Gainesville, Florida, in practice now. And Dr. O'Neil-Smith was trained at Harvard and is in Boston right now. I'll read their bios in a second, but I want to talk to you about this. These two physicians and clinicians are on the front lines, working with patients, working with clients, working to support their families, their communities, their world with the resilience tactics of creating a strong defense mechanism within ourselves to really be stronger now than ever as we look at who has experienced the most risk during this time and what we will be exposed to in the fall come next flu season. We want to get our immune systems as strong as possible, build up our defenses, and be as healthy as possible. So I have these two amazing physicians here with me today, and I am here with you to support each and every one of you in the community. I'm Dr. Anna Cabeca. I trained in gynecology and obstetrics at Emory University. I'm known as the girlfriend doctor because you can ask me anything. So don't hesitate to write in, ask your questions, and share with me what you are going through or what questions or concerns that you have. I am here for you. And today I am here with two of my esteemed colleagues, Dr. Akey and Dr. O'Neil-Smith. So let me just share with you a little bit about them, and then we're going to get right into this topic today. And I know there are many questions that have come up. We're going to talk about what our risks are and what our primary defense mechanisms are. More importantly, right? How do we support ourselves? And not only are my colleagues, ivory tower trained, right? Ivy League trained, but they are also moms, concerned moms, raising children, members of community, and are standing up to say, look, there's a better way to handle this, and there's a better way to deal with this, and here's the information. They published a book that every one of you watching should have in your hands right now, and there's a link up in the notes on where you can get this fabulous resource, okay, which will walk you through a whole bunch of stuff. This is science, like your own immune system. Do you know how it works? Let's get to the bottom of that. Let's understand how it works and go through some of the steps to make it work better. Does that sound good? So be sure right now to share this information, to share this conversation, to like and let me know that you're here with us. So how are you ladies, first of all?
Well, thanks for having us on your show. We're so honored to be on your show as a Fire 'em Up doctor. So Dr. Kathleen and I are teaching partners now for 2 years, teaching doctors. And now when this pandemic hit, we really partnered and put our brains together to put a user-friendly guide for the entire world together. So thank you for spotlighting this user-friendly guidebook to being well, thriving, not just surviving through the pandemic.
Absolutely. Absolutely. No, I'm honored to have you here.
It is so great to be here with you, Dr. Cabeca, because we love teamwork. Teamwork makes the dream work, and you are the girlfriend doctor. You have a trusted group of people, and we love that you would trust us to bring us to your trusted group of people to help people not just survive, but to thrive, because a lot's going on right now, and we want to help with Immunity 101. What do you do for your immune system? How do you make it better? What are you going to do in the moment? What can you do pre anything happening? What can you do in the moment? And what can you do after the fact? There's always something you can do. And that's what your girlfriend tells you.
That is absolutely right. I love that. Thank you. And that is what we're going to do. So let me introduce you guys, my girlfriends, to my beautiful community. So first, Dr. Angeli Akey. She and I have known each other for now a decade, and I admire her work. I admire her compassion as a physician. And she was the first physician that I know of that was doing drive up evaluations for as soon as this epidemic and quarantine started. So drive up evaluations, just right there on the front lines and always innovating. So a little bit of her official background, because I'll tell you her girlfriend story, but her official background is that Dr. Angeli Akey is board certified in internal medicine and integrative and holistic medicine, trained in functional and regenerative medicine. She is the founding director of North Florida Integrative Medicine, Ageless Medical Solutions, and the Palm Beach Institute of Preventive Medicine. She has been in clinical practice for 27 years. Her interest in healing traditions have led her to previously teach at the Florida School of Acupuncture and Oriental Medicine. She now specializes in both the detection of chronic disease at its earliest stage and in the slowing and reversal of its progression. Her undergraduate degree was obtained at the University of Florida, where she was accepted on 6 academic scholarships. She was subsequently the youngest person ever admitted to the University of Florida College of Medicine Junior Honors Medical Program. She served in the U.S. Public Health Service and Medical School and has taught as an assistant clinical professor at Yale University, where she did her internal medicine residency and served as a chief resident. You know, I'm just so impressed reading this. Oh my God, I am so impressed. Like, look at my girlfriend here. So amazing.
Uh-oh. Too many words.
No. Shut the lights out because we've got a standing ovation. She'll be back.
Well, Dr. Anna's coming back. So, yeah. So Dr. Anna and I, we've been friends for a decade. And Dr. Kathleen and I, we've been friends for 2 years, but it seems like we've been friends for decades because Dr. Kathleen and I think very much alike.
Oh, wait.
Dr. Anna.
Hi, I lost you. I lost you guys for a second. I've got to change my internet real quick.
No worries. We just talked because we're girlfriends.
Okay, perfect. Good. You made, okay, excellent. Good. I have people. So I just finished our discussion on Dr. Akey. Very impressive. Now let me read to you guys. And also, Dr. Akey has been married for how many years, Angeli?
24, coming on 24.
Coming on 24 years. Yay. She's raised 2 amazing sons, and their journey, her unrelenting mama care, Dr. Mama Care, led her into functional medicine to help her children and integrative medicine to help her own children. So Dr. Kathleen O'Neil-Smith, she is a magna cum laude graduate of Boston University School of Medicine. You guys know how amazing, I mean, this is just amazing, Kathleen, because you didn't just study, right? You're raising a family, you're rowing on the team. I mean, you're doing all this stuff. Okay.
And she did med school in 3 years and still got magna cum laude.
It's amazing.
3 babies.
With 3 babies. 3 little babies.
3 babies.
All those moms, yeah.
Exactly, right? So she completed her and you need to put that in your bio, darling. I mean, really.
Right.
So
3 babies, 3 years in med school and magna cum laude.
Raising 3 children. I mean, like that, right? You guys, Dr. Mama's here. So she completed her postgraduate training in pathology at Harvard's Massachusetts General Hospital and in internal medicine at the Brigham and Women's Hospital in Boston, one of the most prestigious institutions in our nation. She has a degree in exercise physiology and has been an athlete on the U.S. national rowing team for 40 years and a coach for 6 years. She has worked as an office and hospital-based internist. In 2008, she shifted to functional and regenerative medicine after completing a 2-year fellowship. She completed a stem cell certification through A4M and a TBI certification through AMMG. She has extensive experience using peptides and medicinal signaling therapies in her private medical practice, where she and Dr. Akey also treat the elite among the elite, right? From athletes to, leading individuals and high profile people. We can't say names. And so she treated her only son with such therapies when he suffered a severe traumatic brain injury and was told the prognosis was slim that he would return to normal function. He recently graduated with a master's degree 2 years after his TBI and is currently working in investment management in San Francisco. Well done, Mom. Really. So both her and she has a clinical practice in functional integrative and regenerative medicine in Boston for the past 11 years. And together, Dr. Kathleen O'Neil-Smith and Dr. Angeli Akey formed Fire 'em Up Doctors. Fire 'em Up Doctors. So that's listed here at Angeli's name, FIRRIM up doctors.com for virtual patient care and client care and optimization of our bodies. So today with all of you, just bringing you this these cutting edge women, this resource to better understand how our body is functioning, how we function in times of stress and attack, whether it's viral, bacterial, parasital, I mean, just name it, right? We're going to boost up our own immune systems. And this is a critically important time. We're coming out of quarantine. We don't know what we're going to be exposed to, and we're entering in a new phase. And yet we know that right around the corner, there is another season coming our way. So I am, again, just amazed just honored to bring you guys here and want to encourage everyone listening to go ahead and share this information and don't hesitate to ask questions. So
thank you.
Yeah, thank you.
That was a really, really generous introduction. Thank you, Dr. Anna. And we really are so happy to be in your community as moms and doctors, just like you.
Oh, and I love these people who are showing up on the screen.
Yes. Yeah. So everyone's here. We are just anxious to hear what you're going to say. Well, first of all, share with us, what was the impetus behind writing your new book that's hot off the presses right now?
So as you said, that I've been out there treating my 6,000 patients in my regional practice in North Central Florida since March 15th and doing COVID swab testing, mostly because my mama bear went into action because I've had 21 years taking care of a population of patients and I really felt protected. Yet for my 4 other healthcare professionals, I wanted to make sure the inner sanctum of our building was kept clean and viral free. So it was me who was going outside to do COVID swab testing and manage our patients. And yet I wanted to keep a close connection with our population. So we started doing town hall meetings every Friday. And we pivoted to telehealth. We did group medical visits. So the communication with our own population in North Central Florida generated a lot of the work within this book as we tried to come up with stories to explain to the patients how to fortify their own immune system, number one. And number two, just to explain what the virus is about and the things that we've always talked about with my sounding board, Dr. Kathleen, who's my teaching partner, mostly for physicians. With the Fire 'em Up Doctors, when we talk to doctors, we say, we fire you up to fall in love with medicine again. And for patients, we fire you up to take control of your health. And so we're hoping to fire up your population to really take control of their health. And so Dr. Kathleen's always been my sounding board through all this. And as we approach difficult situations and cases, we were always on the phone trying to work these out, pull the literature, and we have interns involved on our team. So we pulled the literature and pooled it into 4 sections that are very, very user-friendly in this book.
The most important thing is, too, that we had been working on immune system health for quite some time now, Dr. Akey and I. Well, I'm going in the wrong direction. So we were working on some immune protocols and how to fortify the immune system and helping people understand, because we know that the things that we're exposed to generally every day, whether it's through food or through microbes or bugs or things like that, are affecting our immune system, including relationships. So there are all kinds of things, whether you're going through menarche or perimenopausal or postmenopausal, your immune system is affected. So we've been working along with Dr. Kebeka, our dear friend. Whenever we're together, it's the most wonderful time because we get to share. So we've been talking about the immune system and we all bring our ideas together and then they expand and evolve. And it's just like fireworks. But once we ended up in this particular situation with, needing to quarantine and needing to distance, we wanted to figure out, what was the important information out there. So we then shifted. We changed our game, and we changed our game quickly. And we changed it to say, what do we need to do? What is the, oh gosh, what is the, having a little dyslexic brain, what is the information that we need to get out to people so that they can understand how their defenses can be up and they can be in the best situation when and if there's an exposure to anything that could be harmful. So we then created a living document. And with this living document has been created by a big team of people, all of these interns, as Dr. Akey mentioned, and these interns have done tremendous work delivering us lots of information, and we've scoured through this information to make it original, to make it meaningful, to help you understand what is it that you can do. And we put together that instructional guide so that you could take it home. It's a living document. It will change. We do not have all the information, but what we want to do is help you understand what information is here and how can it help you. And the most important thing that we believe is we care, number one, about your well-being. It is our most important priority, as it is Dr. Cabeca, which is why we're good team members and girlfriends. The reality is that if we can help you to understand what knowledge you need and what actions you can take to fortify your immune system, understanding Immunity 101, we're in. Call us.
Well,
go to our website.
Yeah, absolutely. So let's start with that Immunity 101, because this is a section in here, which I thought was just so helpful to get this information into everyone's hands. So let's talk about Immunity 101.
Wow. Well, I think one of the things on Immunity 101, first, thanks to our team of interns who did that beautiful artwork, remarkably beautiful artwork, and very simplified. But the immune system is really where, many of these attacks take place. And they could be any kind of attack. They can be chemical, they can be microbial bugs, or they can be physical. But these attacks take place in our inner immune system. We have an innate immune system that we're born with, and we have another immune system that's called our acquired immune system that we acquire through our lives. And so we kind of go through the different aspects of that immunity to help you understand how to fortify each aspect of it. And really, with respect to how an exposure affects you, an individual, what's the patient-centered component to it? It will have to do with these specific components or nutrients even. Nutrition is really important. The nutrients, whether you're deficient or not in particular nutrients like vitamin D, how will your innate immune system respond and how will your acquired or secondary immune system respond?
And that's what we're talking about too with herd immunity, right? Talk about like what we're talking, we have to build up our own immunity and then herd immunity. And you talk about that in the book too, because it's not just about us as individuals in this situation.
Yes. So when you're talking about herd immunity, you're talking about a population that needs to have experienced and have developed antibodies to the infection. And so that number is around 60% that would have needed to experience it. So within my population in North Central Florida, I have 6,000 patients, of which less than 1% have antibodies. So in order for us in my population in Gainesville, Florida, to develop herd immunity, 3,600 of my 6,000 patients have to have experienced the infection. And so what I'm trying to gear our population up is to be ready, to have their own body ready and fortified, or their castle ready to shore up any cracks in their castle, so to speak, or their body, so that when the infection comes, that they could beat it off. I have had 5 patients diagnosed with COVID-19 virus within my practice that I diagnosed outside doing drive-up evaluations. And I always refer to patient number 3. So patient number 3 is a 62-year-old retired Army man who spends a lot of time in the gym, eats clean, and is aware of sleeping and exercise and everything we talk about. He eats clean, he's got great relationships, and he caught the virus in the gym. Actually, it went to community spread in late March, and it was the most amazing thing. He came to see me in the parking lot with a fever to 102, and he had the red eyes, so I knew he had COVID-19. I was pending the swab, but I did a telehealth follow-up 3 days later, and he says, "Hey, doc, can I start doing push-ups?" And so he recovered at 62 within a week through the virus, because he went into the virus with a fortified immune system. He had shored up all the cracks in his castle by eating well, sleeping well, great relationships, and he was on a protocol that I put him on to strengthen his body. And so if you go into it well, you'll come out of it well.
Yeah, no, I think that's a really good, and that's what we're doing right now. We are working to strengthen our bodies, to fortify, fortify the castle, right? Fortify. In the Bible, it says our body is the temple of our spirit, but really it's, another translation says it is the cathedral of our spirit. So it really is the cathedral of our spirit. And so a lot to repair constantly. So we want to work on this. So we're going to talk about, can you just share a little bit about what happens? Like, what are the typical symptoms of what's happening when someone is affected? And then I'd love for you guys to share your wisdom on how you are fortifying the castle. So, yeah, definitely. And then for everyone listening, just coming on, I am here with Dr. Angeli Akey and Dr. Kathleen O'Neil-Smith, experts, the most intelligent women in the world, amongst the most intelligent women in the world, and heart-centered and really caring, and have put this resource together that is incredibly helpful and just became available this week. So an amazing resource to explain what's happening, what we can do about it, and some of the cutting edge science they've based their recommendations on, all heavily studied, all, heavily researched, and with great detail and great caring, bringing this to all of us. So again, huge amount of love flowing here for your service. This, I know, is a labor of love. So let's talk about that. What's happening when we're exposed? What do we know now to be true at this point?
Well, I think, Dr. Akey has another patient, patient 0, who's a younger woman who came back from Italy. And that's an interesting story that we need to tell you as well. But one of my patients is an Italian woman, and she's in Boston, and she's been in Boston. She's in her probably late 50s, and she's been a patient in the practice. And as she watched what happened in Italy, right, she was really distressed because her entire family is in Italy. She's living here as a chef in Boston, an amazing Italian restaurant I love. I go there all the time. And she'd been coming to the practice and, she has a proactive approach to her health, which all 3 of us like to do, right? So she calls before she gets sick. She got sick. And she calls and she says, what do I have to do? Everybody's dropping at home, and I'm in this industry where I'm seeing a lot of people. And how am I going to keep myself safe and protected? And what do I need to do to be as strong as I can? So she was doing a number of different programs, like different vitamins and nutrients and whatever else she needed, like vitamin C and vitamin D and zinc, and just some basic things, that we talk a lot about in the book, that don't necessarily prevent you from getting it, but at least strengthen your immunity if you do get it, right? And there's a lot of research on vitamin D where we know that it can't prevent you from getting it, but you certainly will have a better experience once you get it. And that some of that research has been done out of Boston, out of Northwestern, in Chicago, etc. But the point is that
one note on that, Kathleen, is that also we know without a doubt that people with low vitamin D have a worse outcome.
Yes, for sure.
So that is what the research is showing.
Yeah, and so in terms of like looking at healthcare, the quality of healthcare, the age of populations and things like that, there were a group of researchers, MDs, doctors, researchers, who looked at this data and basically said, what's up? It's Italy, who's had the most deaths per 100,000. They have one of the best healthcare systems in the world, right? And my patient, who's from Italy, is like, no. I mean, she comes to me, she's like, the healthcare system in Italy is great. But she got sick. So she was one of my patients who got sick early on. What happened to her? Well, all of a sudden, she kind of had a sore throat. She had a fever. The initial symptoms she had were a lot of pain, fever, and a lot of pain and exhaustion. So the pain was kind of a fascial muscle pain, a nerve pain, a burning pain, not really like a hard workout or anything like that, but just this nerve pain. And so she was like, what is going on? And it migrated throughout her whole body, sometimes in the lower extremities, sometimes all over, and a lot in her chest as well. Heaviness and pain in her chest, fever. That then progressed. She was fatigued, fever, pain. She stayed at home. She went to get a nasal swab. It was negative. And Dr. Akey and I will tell you that 40%, 4 out of 10 people, will have a negative swab. And I can talk a lot about that, but I don't want to do that right now. But then the swab is not going to be the best way to determine a positive test. And in fact, there's no one test that will tell you whether you have COVID or not. If it looks like COVID, smells like COVID, sounds like COVID, it's COVID until proven otherwise. So she then lost her sense of taste and smell. She's a chef. It's been now multiple weeks, 6, 8 weeks. She still doesn't have her sense of taste or smell back yet. But she basically was able to be home because she fortified in advance, watching what was going on in Italy for 6 weeks. She fortified with a lot of different supplementation that is we outline in the book and the data for that. And basically, she recovered at home with only Tylenol. And it was about a 10-day recovery period of being unwell. By 10 days, she felt better and could go out. And that's pretty classic. Regardless of what any testing shows, negative for the infection in the beginning, she still had the infection. And ultimately, we know she had the infection because 3 weeks later, we measured her antibody testing, and she had antibodies specifically to this particular bug. And as a result, we know that she had the bug, she got through the bug, she had the classic symptoms of the bug, the classic length of time of the bug, she developed antibodies to the bug. And I would say, with my original belief, that she is protected from the bug at least for 12 to 24 months. Is that proven? No, but that's the way all infections go. And there is data to suggest that that is correct.
Well, and on that note, we have from Facebook, Stephanie wrote in and she said, I've had COVID for 7 weeks, hoping next test is finally negative. I suffer from MS, multiple sclerosis also. So I think that if we're looking at testing, repeat testing, those antibodies should say positive.
They should say positive. He wants to do a quantitative, an antibody test that shows her the number of antibodies. And that's really important. But the problem is, like, there's been an article recently this week through NPR that basically talked about a nurse with testing. And she's been out of work for 10 or 12 weeks because she was positive for COVID, had symptoms for 10 days-ish. And she cannot go back to work until she tests negative. But they're doing the nasal swab testing, and that's really problematic. So she really needs to have the antibody testing. She's asymptomatic. She's been asymptomatic by day 10. So this is now weeks ago, right? And they continue to do the nasal swab testing that's often negative or positive. Let me explain. I'll give 1 minute on that. If you have a bug, if you have an ant, and you cut the ant in half, you kill it. When the ant's alive, the ant can eat your food. If you cut the ant in half, the ant can't eat your food. If you do a culture test and you need to grow ants, you can only grow live ants. You can't grow dead ants. You can't take half of the ant and grow another ant. When you do a PCR test, which is what the nasal swab is intended to do, you can measure the right half of the ant, the left half of the ant, or the live ant. When you do a subsequent test when you no longer have symptoms with PCR, you may be getting the dead bug. You're not getting the full live bug. You could be getting half of that bug. And so it's going to come up as positive. And it may be positive for a long time. We don't really know. So now NPR, when they did this article, we're talking about, well, certainly for the Brigham, where this woman is a nurse, they shifted their requirements to no longer the swab testing, because it may not be negative 2 times in a row, but more the antibody testing to determine if you have antibodies and are protected.
Yeah.
So when Stephanie wrote in that she's infected for 7 or 8 weeks, I'm curious to know if it's RNA COVID swab testing, or is it that she's really symptomatic and sick still?
Yeah, that would be important. That would be very important to know.
And so let's talk about how we're creating a resilient body, building up our defenses. What should we do now? What should we do at the first signs of illness?
So the first thing to do is to go to our website and download the 14-day monitoring guide that we put on there for you all to have, and monitor your the 3 essential things that I need to monitor my patients who are starting to get sick are a good thermometer. So a temperature, even a low temp of 99 is something to watch. A blood pressure, in case you get the GI illness, that you get the gastrointestinal symptoms of vomiting and diarrhea, which happen 4% and 5% respectively. It can happen aside from other symptoms. And then it's hard to get now, but if you do have access to a pulse oximeter so we can monitor your oxygen level, you want to make sure that stays high, 95 to 100. But if you see a trend down that's concerning, especially as it bombs down towards 90%, because that's a critical level for tissue oxygenation. So monitor yourself with that 14-day monitoring guide. And there are some natural kitchen remedies that we put in our book, like you could do eucalyptus steam, you could use a curcumin. You don't want to use nonsteroidal anti-inflammatories like Motrin or Aleve or anything like that, but you can use Tylenol, as Dr. Kathleen's patient had, and just manage your making sure you're well hydrated. So we even have how to hydrate naturally. Certainly you have Pedialyte and Gatorade, but there's ways to make your own hydration formulations.
But first, Dr. Akey, can you explain why not to use the Advil, Aleve, ibuprofen?
Yeah, so you don't want to suppress your own immune system, similar to like prednisone. And so that's why it's not recommended to use those NSAIDs or nonsteroidal anti-inflammatory medications. But you still have to control your temperature.
Yeah, absolutely. Okay, so let's look at what's in our needs to be our at-home doctor bag. Okay, yeah, go ahead and share that.
So I just wanted to explain. So we were going through cases, and this is a beautiful graphic our team put together. But basically, there's 4 blocks to this. Day 1 through 5 is incubation, but the incubation is where you have the virus, but you don't have symptoms, and that range could be 3 days up to 21 days. But classically, it's between 3 and 5 days that you start having these symptoms. So phase 2 is symptomatic, where you have viral replication, where those COVID swabs can pick it up most readily, but you're also the most infectious is when you start seeing us physicians in the healthcare team. And then you move into phase 3, where your innate immunity comes into play, and you have the early lung phase if your lung's going to get involved. And that's when you start having shortness of breath and mild decrease in oxygen. And then if you're predisposed or if you're at higher risk, you could end up in phase 4, which is a scary phase, the late lung phase, where you move your what's called adaptive immunity, and your T cells are part of the special forces that are coming to try to get rid of the virus, but sometimes they're over exuberant, and they can cause something called cytokine storm, which actually causes your own lungs to fill up with what's called exudative debris, which is fluid and pus and blood, actually, which makes this type of acute respiratory distress syndrome unique with COVID. So basically, the difficulty with this particular virus is that you can get over the cold, but then later you could have the lung involvement. And that's the part that you want to monitor very closely.
So I think a couple of things that Dr. Akey mentioned. One is that an ounce of prevention is worth a pound of cure. So before in that phase 1, even before the phase 1, if you check your vitamin D level, if you check your natural killer cell function, if you look at your entire being, and you certainly, like, let's just say there are lifestyle, and what can you do? You can eat, as Dr. Cabeca has taught you, clean, green, and lean. I mean, there's no doubt that Dr. Cabeca's supplements and the things that she promotes will keep you clean, lean, and green, alkaline, and all of those good things. So that's number 1. Number 2 is sleep. I probably would reverse them, because sleep is what we should do the most of in a day, at least 8 hours, right? If you're only getting 6, get to 6.5. If you're getting 6.5, get to 7, but improve your sleep, right? This is all before you get sick. When you get sick, you won't have a choice. You'll sleep a lot. Probably not at night, because the pain may keep you up and the fever may keep you up, but you will sleep all day. So prior to this, get sleep, rest. Stress, which means not sleeping, is friend of the virus. So stress is friend of everything, every problem. So please reduce your stress, whether it's meditation, breathing, qigong, movement, but sleep is central to that. So number 1 would be sleep. Number 2 would be all the things you learned from Dr. Cabeca, the girlfriend doctor. Clean, lean, mean, and green. Let's go. Get on the diet. Start to eat and drink your maca, your mighty maca. Let's go. That's really, really important. That will decrease any chance that anything, including bugs and viruses, can disrupt your life, disrupt your barriers, and invade your being. So that's really, really important. The third thing would be movement, to get the blood to flow. The blood needs to flow. If the blood doesn't flow, it becomes viscous and it coagulates, and we don't want any clots, no coagulation, nothing that could lead to, sitting on a couch, but being a couch potato. We have to move. And then the last thing is keep your lungs clean. You've got these residual spaces in the bottom of your lungs that never get cleaned out. They are the deep parts of your closet. Open them up, breathe, and let them out. And I know probably Dr. Kebeka has shared so many things on that with you, but those are some really basics. The vitamin D you can replenish, and the vitamin C. One of the things that you mentioned earlier, Dr. Kebeka, is that you said that people want to know, why don't animals get this? In fact, we can use llamas, or we can use other animals to get antibodies and to treat people with these antibodies once we clean them up. I mean, we can't just take the antibodies from llamas and put them in us. We got to create something from them, right? But one of the main reasons is, Dr. Akey just mentioned the T cells and the natural killer cells. The main reason that these herds get immunity so rapidly is from Linus Pauling. And Linus Pauling has written books on this. And he has written books, and they're just the most fascinating books. I'm not a geek and I'm not a nerd.
Well, let's just emphasize Linus Pauling won the Nobel Prize, right? A Nobel Prize award winner. I mean, just brilliant.
And I'm sure Dr. Akey's right in his footsteps.
Absolutely. That sainthood and Nobel Prizehood, she is there.
Bravo. But certainly, I mean, he wrote that these animals, these herds, make their own vitamin C. And what I learned reading his book is that we don't make our own vitamin C. Humans have a mutation, and they are not able to make their own vitamin C. And one of our dearest friends, Dr. Ari Vijani in California, he's an immunologist. He studied this, and he basically has looked at all the data on vitamin C. And if we replenish our own vitamin C levels, we increase our natural killer cells remarkably, 200%, 400%. We cannot do that on our own. It's not even a possibility, but llamas can. So we need to supplement with these kinds of nutrients that keep us fortified, that fortify our immune system before we get sick. An ounce of prevention is worth a pound of cure.
And natural killer cells are the special forces ninjas against abnormal cells like cancer cells, as well as viruses. So we really need to support those natural killer cells. So what she was explaining was fortifying your castle before you get invaded with the virus. And then you're the, it's a medieval analogy. So you're the king of the castle in the chess set. And so that's what she's saying, is those are measures to make sure that your castle's strong before the virus tries to attack you.
Strong defenses.
Strong defense mechanisms, and that information too, as far as resources, as well as in your book, Kick Over to the Curve. There's the digital download as well as the hard copy, which I'm an old-fashioned hard copy book person. So
digital download's pending. It hasn't happened yet, but all the references, there's 140 references and hyperlinks that are actually uploaded to firemupdoctors.com for anybody to look at. That's FIRRIMUpdoctors.com. It has the references and the hyperlinks. You could look at all the papers, the original papers, multiple papers on vitamin C, D, zinc, and the basic immune supplements that you should consider to fortify your immune system against cancer, against the exposome, against viruses, against bacteria, against parasites.
Okay, you're going to have to explain the exposome because we don't know what the exposome is. Explain the exposome.
You want to do this one, Dr. Kathleen?
Sure. Love the exposome. The exposome
of course you do.
is like the air around us. So it's everything we're exposed to from the time of conception until now. You can't get rid of, the wonderful, you don't have this, but memory you have kicking your feet as a baby in this loving situation. You can't get rid of the time when you got bullied by somebody in school when you were 9 years old. All of those things stay with you, right? You can do a lot with them. They all feed you. They all enhance you. They all fortify you in different ways, particularly if you pay attention and use them, to your benefit. So you can spin an A story for that. But the reality is that the exposome is a combination of every bug you've been exposed to, all the chemicals. So all of the physical things, all of the metaphysical things, all of the relationship things, everything that's making you who you are. We all want to be known and we all want to be understood. That's why we love our girlfriends, because they can know us and love us and understand us in a variety of different ways. But the exposome encompasses all of that and influences at a very basic level your immune system, how your genes function and how the genes tell your immune system to keep your defenses and your castle walls strong.
Yeah, no, I love that. And I love it when we talk about this. It goes beyond our influence. And one thing that you guys talk about in your book, and I want to show everyone this, is your sphere of influence. Something we've been doing in our Keto-Green, in my book, Keto-Green 16, and in our Quick Start Challenge group is talking about detoxing. And really, like, this is a spiritual practice, cleansing ourselves. And that way we are stronger, and we then fortify our body, our families, our community, and the world in this way. And you address that. You address that here in your book as well. And this is from Dr. Akey's amazing book, The Hormone, Fine Tune Your Hormone Symphony, that was published in
2011 now.
2011, Fine Tune Your Hormone.
And it's on Kindle. If you're
This is a really important part, because when we talk about, like what's under the surface, that, like what can influence illness, right? And I think this is really an important thing. In medical school, I was on ICU rotation, and I was taking care of an 82-year-old man who had acute respiratory distress syndrome. And he'd been on a vent for 2 weeks. The prognosis was not good. Like, we're never going to get him off. He was basically ridden off, but his family came in every day. They were a Middle Eastern family. They prayed, they read the Bible, they talked, laughed, held vigil over him every day, and like for the entire week that I was there. And do you know that he defied all odds, got up off the vent and walked out of there? And now that's the power of community, love, and prayer. And the second thing is in residency, I'll never forget that, but then in residency at Emory University, doing internal medicine rounds at Grady Hospital, we had a young man, 27-year-old, who was HIV positive and suffering with cytomegalovirus and other complications. And he, by all standards, should have, been strengthened, felt better and left, right? But the sad thing is that no one came to visit him. And I inquired from the nurses, every time I see him, there's no one there. Does he not have families? His family won't talk to him. I ended up calling his parents and saying, he's really, going downhill rapidly. And his father, and his parents didn't want anything to do with him. They'd written him off. And I had to be rotated off that rotation because I found out I was pregnant. And that definitely CMV, cytomegalovirus, is very dangerous in first trimester pregnancies. I was rotated off, but I came back a week later to check on him, and he had died. And he died of loneliness, not from the disease, not from the HIV, not from the virus. And so I'll never forget that, right? How family, how community, and how this connection, how we can fortify ourselves, fortify our castle, so to speak, in order to, it goes beyond the medicinals, goes beyond the pills, the products, the programs, the potions, right? It goes beyond that. It goes into this community, caring about each other enough to share this information, to listen, to voice your concerns so that you are standing up and you are also being heard. And that is so important as a woman too. I think especially as women, that we feel like we're being heard in this situation and listened to and intuitively guided, right? Intuitively guided. And I believe you too, very prayerful women are intuitively guided in this way to say, okay, this is the right next step. These are the things that we can do. There's so much wisdom in the world, right? In worldwide medicine and in these modalities to really help us fortify.
It's real. I know it makes me think, Dr. Akey, when we think of these Italian women who are 100 years old, or some of these other people who survived this, and I read the articles on vitamin D and how these researchers and doctors looked at the global data on vitamin D and said, well, they're making it about vitamin D. I think you're right, Dr. Rebecca. this is much more than vitamin D. I mean, certainly vitamin D is important, but to have healthy relationships and to know who, it doesn't have to be your next of kin. It could be, like we are girlfriends, right? To know who loves you, to know who cares about you, to know who's got your back, and to go through this illness, because this Italian patient of mine has nobody here. I went through this with her. She knows I love her dearly, and she had no doubt. And she's one of the strongest human beings I know, because she fortifies good relationships. And her food that she creates in her wonderful Italian restaurant is called cibo con amore, food with love. And her whole thing is cibo con amore. So it's way more than the food. It's way more than the nutrients. And Dr. Akey has written so beautifully about this in her former book, and brought it to this new guide that we have, this new instructional guide. It's really important.
And your favorite hormone, I think, Dr. Anna, oxytocin, directly combats cortisol. And that, especially with women, the statistics with the ACEs trial, that 4 out of 10 women have experienced adverse childhood events. And that in 2018, it was published in the Journal of the American Medical Association that if you have these ACEs, it actually doubles the risk for autoimmune disease or immune confusion. And it's very well documented that chronic stress from those early adverse events can lead to weakened T cells, killer T cells, those ninjas that fight viruses and cancers. And so it's really important to get healing during this time, this pause, and find your spirituality or EMDR. I love recommending patients undergo eye movement desensitization reprogramming to really do the deep healing that needs to happen to fortify not only their bodies, but specifically their immune systems. And that's psychoneuroimmunology. That's actually documented.
I love it. I love it. Absolutely. And this whole field of psychoneuroimmunology. And yes, oxytocin is my favorite hormone, y'all. I'm telling you, we give some oxytocin to these ladies. This is amazing.
Love oxytocin.
And you created a section in here to also go through pros and cons on supplementation in this. And you list out the different supplements, as well as why, dosage, and references, as well as the pros and cons listed in there. So vitamin C, I'm going to read through it. Vitamin C, ascorbic acid, zinc, omega-3 fatty acids, vitamin D3, probiotic, curcumin, thiamine, B1, quercetin, EGCG, which is green tea extract, right?
Yes.
And astragalus, melatonin, colostrum, elderberry, medicinal mushrooms, and beta-glucan. So you've listed out these this great information here, so that people can look at the information and at the resources and at the citations and at the what is said about and for and against these ingredients. So I love that you've included that in here with this understanding. I mean, this is fabulous. So and you also put in your temperature guide so that you can chart, right?
Yes, the 14-day monitoring guide. If you go to fireemupdoctors.com now, you can download that for free. FIREMUPdoctors.com.
Tell our audience how they can get your book.
So yes, go to our website to it's FireMup. That's function. It stands for our training: functional, integrative, regenerative, restorative, internal medicine. FireMup Doctors. So FIREMUpdoctors.com, and you can just order it. We'll ship it to you. You'll get it in 2 days. But what we did was we shared the 140 references on there, so you don't even have to purchase the book. You can look up the references.
You want to purchase the book. I mean, get the book. I mean, this is, and who knows how long it's going to be available. You're at your last 100 copies right now. But that's a really important thing. I mean, this is a resource. One thing that you talk about, the symptoms as well as prevention. And one thing I want you guys to mention before we close is, what about wearing masks? What's the deal with masks? I'm in South Georgia. I don't know, but I've gone out this week and eaten out, and there ain't anyone wearing masks right now.
Wow. You need to wear masks. It's aerosolization and droplets still the number one way of transmission. Social distancing is key. I know that there's other discussions out there besides.
Let's call it physical distancing instead of social distancing.
Physical distancing.
I have an issue with the term because we want to be social, right? but
Yeah.
we'll just make
Social
that
media.
physical
I like
distance.
that. Yes, thank you, girlfriend.
Physical distancing, I like that too.
Mhm.
Yeah.
That's good.
Well, the reality is, remember, these bugs are transmitted from humans. You're not going to get this from a bat right now in Georgia or Florida or Boston or anywhere, right? So you're going to get this from another human. And how are you going to get it from another human? The number one way, it has to do with the amount of virus you're exposed to, the length of time you're exposed, so the viral load. We understand that with HIV, the viral load, the length of exposure, right? And your immune system and how healthy it is. So we can talk about all of that in the book. But the reality is that when you are with people you don't know, if you don't wear a mask, we know this virus lives in human secretions, particularly in anything that comes out of here. So if you're crying, if you're sneezing, if you're snorting, if you're coughing, if you're singing, if you're doing speaking loudly, effusively, laughing, you're going to let respiratory violence flow. And depending upon where you are in relation to the person who's infected with those virus particles, they have a silent infection. They may not even be sick yet. It could be that phase 1 window of 0 to 5 days or 3 to 5 days before they become sick. You can be exposed. So to protect yourself, not because you will get so sick and die, but because you want to try to be well. But you can do the ounce of prevention. You can wear your mask. Now, I saw a woman walking down the street the other day. I was driving, nobody around her for miles. She was wearing a mask. It's not necessary. There's nobody there. This is transmitted by humans. So it's not likely she's going to get it. If somebody had run by there 5 minutes earlier and snorted or coughed or sneezed, it's still not likely she's going to get it walking down this street. But if you are with humans that will snort and cough and sneeze and sing and do whatever, then it's possible that you will get it. So if you don't know these people, you should really protect yourself, because until we have some better ideas about other ways to treat this that are more effective, maybe from a medication standpoint, and if we don't have a heightened immune system, we hate when you aren't well, and we love to see you be well, fare well, and be defended from an immunity perspective against all microbes.
Yes.
Okay. Can I talk about your book and why I think it helps?
Oh, please.
So our practice was involved with clinical trials, like 8 series of group medical visits over the past year. And, with this COVID-19 virus, it really is, you get sicker if you're pre-diabetic, metabolic syndrome, or diabetes. And so within our studies within the office, many people resolve their prediabetes. Hemoglobin A1C is going from 6.1 to 5.3. There had a gentleman lost 30 pounds. Remember? He lost 30 pounds within
in 16 days. Amazing, right? And his blood pressure went down. Mm-hmm.
And then there's evidence that the virus requires an acidic environment to replicate at a cellular level. So being in an alkaline state is really important. The other thing is that your discussion about stress management and how it's really hard to be alkaline if you're stressed is really important to not be stressed to fortify your immune system. So Keto-Green is totally in line with fortifying your immune system.
Yay. Thank you. Yeah, we're finding this in our Keto-Green 16 challenge group. The reporting back at the end of the 16 days is feeling stronger, feeling more motivated, feeling healthier than many, in a long time, not to mention release of hot flashes and good stuff like that. So,
our last medical visit from March, right when this happened, we started class 1 on like March 5th, and then the pandemic hit. And that particular group of patients fared so well that it made me come up with that line that you could thrive and not just survive through this pandemic, because they were following all of these principles and were supported from an immune standpoint, and they were connected in the group. And that was the group that had that that man that lost 30 pounds, dropped his blood pressure to normal. I had to see him because he was dizzy because his blood pressure was normal. His prediabetes gone. So that really did help him to strengthen his castle. So great work, Dr. Anna.
Amazing. Bravo.
Thank you. You guys are amazing. I mean, honestly, our mess becomes our message, right? always looking away for the to help ourselves and help other people, right? And this is it too. Help ourselves, help our families. And this comes with each and every person. We got a great question that came in from one of our listeners on Facebook, and it said women are often prescribed antibiotics for UTIs. What's the impact to a healthy immune system and regarding COVID, and what is a healthier alternative?
So if you have an infection, you have to get rid of the infection. I like to think about prevention of UTIs so that you don't need antibiotics. But if you have E. coli, to get a severe infection from something untreated that's treatable doesn't make sense either. So when you're getting treated for a true infection, you want to take probiotics to rebalance your microbiota. After we didn't even get a chance to talk about the microbiome and its training of the immune system. Mm-hmm. That might be another time. But if you need an antibiotic, take the antibiotic, but make sure you're taking probiotics at least 2 hours away. But I'd go back to let's prevent it in the first place. If it's post-coitus, or you could take, you could do measures of hygiene, but also D-mannose is a wonderful supplement to cause, I say D-mannose is like WD-40 on your bladder wall, where the infection, if it's trying to lay hold on your bladder, can't. It slips right through with hydration. So if you need an antibiotic, take an antibiotics, but make sure you take probiotics.
But I agree 100%. Prevention is key. So for me and my clients, especially with postcoital UTIs, it's daily vitamin C, 2,000 to 4,000 I use daily. A daily probiotic. We use Pura ProbioMax in our office. And for definitely for vulvar health, urethral health, if we're over 40, over 50, Julva, right? It's topically, right? This is the bomb, diddy bomb, right? This is amazing. So those are things, prevent UTIs. And I know clients with recurrent UTIs that we start this regimen and they don't have to be on daily antibiotics, regular antibiotics, anything like that, that's often prescribed for recurrent UTI. Get to the reason for the problem to begin with. And so that's just definitely one way that we can prevent that. So it's a great question.
So that's actually, yeah. And we were involved in the clinical trials with Julva like 2016, 17, and we would see that over and over again. So what you're doing is repairing the barriers when you rejuvenate the vulva vaginal area so that the infection can't even lay hold.
And that goes, let's talk about repairing the barriers. I know we're going to close. I've gotten a lot of your time and so much beautiful information. I love our conversations and look forward to having more over a glass of wine or tequila.
In Boston, maybe in the Italian restaurant in Boston.
At the Boston restaurant, yes.
Little Aperol spritz.
Love it. And so, in this concept of repairing barriers, leaky membranes get us into trouble, whether they're in our gut, in our brain, in our heart, in our vessels, name it, leaky membranes. So the concept is we're going to repair, and you go through great healing the barrier, right? Fortifying the immune system, kick COVID to the curb. And we want to do that and look at the research and have it in one place. Cause man, right now it's, master Google all over the place, right? Master Google all over the place. And so, and so I think that's really powerful stuff. Now, I want to thank you, ladies, so much, Dr. Akey, Dr. O'Neil-Smith, and encourage our listeners to get their resource. The link is in the notes. And definitely share this information with your friends, share this information with your followers, and let's spread the word on what we can do. What's the reality, what we can do, what's the possibility. And the more we know the possibility of 100% recovery with the right next steps, that keeps us stronger and healthier. But again, as Dr. Akey so well said, an ounce of prevention is, and Dr. O'Neil-Smith so well said, an ounce of protection, an ounce of prevention is worth a pound of cure. So preventing, doing what we can. You have a whole section in here on prevention, and that is key. So
can we invite your community to join us every Friday from 3 to 4 o'clock until the pandemic's over? We have Facebook Live talking about these principles. So
absolutely. That's at your Facebook page. That's also in the notes here at Fire 'em Up Doctors. Right at Fire 'em Up Doctor. So again, I want to thank you guys so much for being here, and tell also how our audience can get a hold of you too.
So look at our website. It's firemupdoctors.com. That's FIRRIM updoctors.com.
You can send us an email, but spread the love, just like Dr. Kebeka is spreading the love to her community. We want to be part of a bigger community, spreading love and spreading healing.
Oh, I love it. I love it. Thank you guys so much.
Thank
And thanks to all
you.
our listeners. Please
Thank you.
don't hesitate to share, like, love, and communicate with us, right? There is never a silly question. And we are here for you. We are here for you. Thank you all for being with us today. Till next time, it's Dr. Anna Kebeka.
Thank you, Dr. Anna. Thank you, Dr.
Thank
Kathleen.
you.
Thank you, community.